Hello and welcome to Unstress. I'm Dr Ron Ehrlich. Now, today's episode deals with some important questions. Why is it important to tend to the health of the microbiome in cancer care? How do circadian rhythms impact on cancer prevention and treatment? How can fasting be used in cancer care, and why should you avoid detox programs when going through cancer treatments? Well, my guest today is Cathy Biase. Cathy is a registered holistic nutritionist, a cancer coach, who's dedicated to helping people understand the power that lies at the end of their fork. Yes, your food as medicine. A breast cancer survivor herself, Cathy specialises in the functional application of nutrition for root cause health improvements for chronic disease, with a particular focus on cancer care. Cathy has a Bachelor of Science from the University of Toronto with a major in psychology. She graduated from the Canadian School of Natural Nutrition and is a certified professional cancer coach. She's currently the host of The Health Hub, a talk show, a radio talk show and a podcast covering various aspects of integrative health. It's always good to talk with hosts of podcasts. I hope you enjoy this conversation I had with Cathy Biase. Welcome to the show, Cathy.
Thank you so much for having me. I appreciate the opportunity.
Cathy, a nutritionist, a cancer coach, a major in psychology, all of those things obviously very much connected, but I wondered if you might share with us your own journey that's brought you to this point.
I was working with my father, so still within the investment industry. And after his illness, we had to shut down his business I would guess within a month and a half. I felt a small lump in my right breast and went for my first mammogram because I was only 47 at the time, and really no history of breast cancer. My mom had just been diagnosed with breast cancer, so the history hadn't been really developed, so I was not really flagged to come in early. So I went in for the mammogram, and long story short, it was breast cancer. So I went through a year of allopathic treatment in combination with integrative care. And from that journey, my dad's business closing down because of his illness, and then my illness and the subsequent year of fighting off that, I just found that there needed to be something more within cancer care. And to be clear, I was extremely happy with my care. I loved my physicians. I loved everything about where I was at Sunnybrook Hospital. But what I also had, and it was serendipity, because I had just joined a small boutique gym, and before I had my diagnosis, and then when I got the diagnosis of breast cancer, this group of 3 went to task for me and developed a very loose but powerful supplemental exercise and nutrition protocol. And I just felt that it really helped me through everything. I didn't experience much in the way of side effects from my treatments. I recovered very quickly. And that, alongside of what I had seen going through my year in the medical side of things, was other people who didn't have what I had. You know, when you're lining up and you're waiting for your treatments, especially in the radiation, you know, you sit and you wait, and it's because you're going continuously day after day for, you know, on average about 25 sessions. You see the same people, and you know, I chatted to a lot of people, and a lot of people had quite a difficult time getting through their treatment, and I just felt that piece, which had been so crucial, I felt for me, was missing. And I wanted to, people who go through cancer, a lot of us are so grateful to come through the other side, that we want to give back, because it is very difficult. And this is what I wanted to do. I just felt that this was something that I could do to help other people. And then it just sort of evolved. I looked at how I could incorporate nutrition. I went back to school, and then subsequent from that, I took a course in cancer coaching, and I hooked up with a naturopathic doctor. Again, things just aligned for me. And right out of the chute, I was aligned with a naturopathic doctor that specializes in oncology. And in a nutshell, that's my story, and that's where I am now.
Wow, there's just so much that we can already talk about because, this idea of a breakdown leading to a breakthrough, and also your embracing. And I've had a similar personal experience with my own diagnosis. I had a diagnosis of prostate cancer. Very, very grateful for the incredible skill of the allopathic doctors that I embraced, but I was really surprised that the support, which would have made their job so much easier, is just not a standard part of cancer care.
Mm-hmm. Exactly, I agree wholeheartedly, and it's not. I really like to make this distinction when I talk to people. It's not because the allopathic system doesn't care. I think it's because they are overwhelmed. Yes. And you really can only go in so many lanes and be successful. But what I would love to see is a turnover from the allopathic care and a handshake between integrative. I don't like to call it alternative. No. But I would love to see that handshake where this is what we do and we do well on the medical side, and let's set you up with somebody who can work on your health. And that's what I do. I work on health, which is extremely important.
Yes, tapping into the body's innate ability is quite a remarkable tool to have in your armamentarium, isn't it?
It certainly is, and I don't think we appreciate. We look at disease as a breakdown, and some view it as a weakness. And really, most people would say if they really took a hard look, they were seeing symptoms before the big event. And our body has this wonderful innate ability to heal, and I just that's what I want to tap into. So when you go through treatment, you need time to heal after. If you prepare properly and strengthen your body before whatever treatments you are going to go into, you really just you heighten the chances that you're going to come through well.
Yeah, you also listed quite a story of stressful events. I mean, your father being ill, business closing down, your mother being diagnosed, and then bang, you end up with an unexpected, I don't think we ever expected, but an unexpected diagnosis. So this connection between stress and cancer, I mean, I think we've all heard this story personally from, if we bothered to ask, some stressful events. Well, this is an important part of the picture, isn't it?
It certainly is, and to be perfectly frank, it was stressful. My dad, watching him sort of decline, but I didn't have one of those like huge events that some people can really pinpoint as this was really traumatic for me. This was life, I was a busy mom. I have 4 children, and at that age, they were going hither and yon, and I wanted to be the super mom, and I wanted to do everything well, and I worked, and this is the way a lot of us live our lives. So I don't want anyone to think that, it's a traumatic event that causes stress. Just not attaining and dealing with stress of every day, it accumulates. And this is an important thing to deal with, in cancer and beyond. Stress is impactful in so many diseases and so many aspects of our health that, really giving that a good look at and really including that in your health model is very, very important.
Mm-hmm. Listen, why don't we just take a step back a little bit and just paint a picture of, if you know this, how are we going cancer-wise? What's happening out there in the world? People hear a lot about it, but what do the statistics tell us? Do you know?
Well, the statistics are that 1 in 2 men and 1 in 3 women, and it's really becoming 1 in 2 across the board, will have a diagnosis in their lifetime. So that is quite high. And survivorship is going up. And this is also another aspect of cancer care that really does need attention to as well. We have a lot more people surviving. Survival rate statistically is 5 years. That's statistically what they will use as a survival rate. But we have a lot of people that are living beyond, well beyond that, getting through cancer and living a long life. But that preventative piece, once you've got through your treatments, you finish and you're so in my own, I refer to my own experience. You're so heavily ingrained for about a year in the medical system, or I was, there wasn't a day that there wasn't a phone call or a result or a treatment or something, a recovery. And then all of a sudden it stops and you've got to go back to a new normal. And this aspect, the survivorship aspect, is an area that I have a special attachment to, because I was one of them. And I know that feeling that, well, what do I do now? And then there's the feeling of, what will it come back? What is this ache? What is this pain? And there's a lot of stress in that aspect of your cancer journey as well. So statistics wise, that's where we're going. Mm-hmm. There is an increase in lung cancer. So it's a battle that is having many successes, but yet not enough.
Mm. And we're often told it's because we're getting older, but I'm not sure our kids are doing that well. Do you see many kids in your practice? I do.
I do, and it's difficult to deal with. In practice, we've lost a few children. It is very difficult to watch. It's to see moms. Most of the children that I have seen personally, the visits are mainly with the moms. They come, of course, dad's working. For the most part is the situation that I've seen. I have seen 2 parents come in at once, but oftentimes these are families that have more than one child. So you need one to take care of the one child, and then the parent who's attending to the child that's ill. And it's very difficult.
Mm-hmm. What sort of cancers are we seeing? What sort of cancers do we see in kids?
There's one type of cancer called DIPG. That's a brainstem cancer. It's very difficult to work with. A lot of childhood leukemias. And those are what I see in practice more than anything. As we get older, not as much, definitely. In the area. It does shift.
But let's talk about some of the things that we can be focusing on in the care of cancer. And a topic that comes up a lot, we're hearing a lot about, is the microbiome. And certainly, we've had this very adversarial approach to bacteria everywhere, whether it be in the soil, whether it be in our mouth, whether it be in our body and our skin, in our homes. What about the microbiome? How important is that in cancer care?
It's the focus of my practice, and everything stems from it. The microbiome is vastly impactful on the immune system, in controlling inflammation, in detoxification, in brain health, and that's an area that I find more and more interesting to look at as well, because when we're dealing with things like chemobrain and that sort of thing, a lot of people don't consider that when the gut, the intestinal health is compromised, this can impact brain health. And going through a diagnosis is stressful. Going through treatments can impact cognitively, but working on the gut health can also have a positive impact on that. I'm not sure if I mentioned detoxification. That's also extremely important. And new research is coming out as well that makeup of the microbiome can influence certain medications, certain treatments. Immunology, immune therapy is one area that has been studied, that particular bacteria can have an impact positively or negatively on how well that treatment goes. So It's although there are thousands of studies on the microbiome in dealing with cancer, because cancer is such a complicated disease. We're just starting to get into that aspect. But again, in my area of expertise, working on the health of the microbiome is just, it's very important to all of these functions and to helping the patient get through treatments successfully. So that's where I start. The microbiome is an exceptionally important area of concentration for me.
I can only imagine that what chemo and radio does is sort of almost like a scorched earth, I guess, for the microbiome, or at least the diversity of the microbiome. How do we support people through their therapy, and then how do we rebuild?
Well, a lot of doctors still are not on board with supplementation during treatment. Probiotics, there have been studies both ways. Clinically, we look at blood work, and if we feel that the immune system is quite compromised, we will refrain from introducing probiotics. That's a clinical decision for us. However, when it comes to nutrition and lifestyle, there is a lot that we can do. Adding fermented foods to the diet, and we're not talking therapeutic doses here. So adding things like greens and vegetables, the microbiome will convert nutrients in food to make them more bioavailable to us. So supporting it with the food, sleeping properly, exercising when possible, all these things go into supporting a very healthy microbiome. So fiber, prebiotic fiber, whether that's from a powdered form if you're having trouble eating, or whether it's from increased fiber, prebiotics are exceptionally important as well. So these things can very easily be worked into an oncology diet. And it's where I go to support the microbiome. I also, one of my favorite supplements is actually butyrate, because butyrate is a short-chain fatty acid that's a byproduct of fermentation of gut bacteria. And butyrate is essential for many things, but really essential for the health of the intestinal tract. So when cancer patients, or it's not just strictly cancer patients, when the microbiome, when the intestinal tract is compromised, having the end product, that short chain fatty acid, is something that it's one of the supplements that I go to quite often to support the microbiome.
And you mentioned sleep, and that's obviously a big one right across the board in whatever things we're talking about. But I also know that you're focusing a lot on circadian rhythms, and I think this is a big story that we're kind of just beginning to get our heads around. Tell us a bit about circadian rhythms and their importance, not just in our health, but also in cancer prevention and then treatment. So tell us about circadian rhythms.
Well, circadian rhythm is one rhythm in the chronobiology study. So circadian rhythm is our 24-hour cycle. They're even talking about 12-hour cycles now. But you're right, we are just starting to understand the impact that the circadian rhythm has on health. So just a brief overview. You've got the suprachiasmatic nucleus in your brain, which is sort of the master control of all of the clocks. All of your organs have their own clocks, tissues, cells have their own clocks, and they function and do different things at different times of the day. And there are things called Zeitgebers, but they're environmental clues, mainly light and darkness. Mm-hmm. So what the circadian rhythm does, and what these clues do, is basically engage different aspects of our makeup. So, for instance, on a like broad sweeps, our liver functions during the day in the digestive lane. So it's working to help the body digest food, glucose management, and so forth. But at night, the liver shifts to a different function, and that will be more of the detoxification and repairing. So for someone who's going through cancer, because we're talking in this vein, you want to make sure that your circadians are very well managed, because you want your liver on point for digestion and nutrient absorption and detoxification and everything like that. But you also want it working absolutely properly in the area of detoxification and repair at night. So when we are reading the external markers, things like the time of day, whether it's sunshine or whether it's going into darkness, if our body is tuned properly, then these systems will run well. It's when we cross and blur the lines of how our body is perceiving things that we have difficulty with health. So our eyes help us to see, but they are also mechanisms that signal the brain of change of light and darkness. And when the light and the darkness change, different hormones are introduced into our system. So when darkness comes, in an ideal system, when the sun starts to set, and, back in the day when there were no lights and things, the body would release melatonin, and then that would sort of cue us to sleep, and the body reacts that way. We go to sleep and everything runs well. Now we are really messing up our systems with staying up too late, but a big thing is blue light and artificial light, because our eyes still perceive this as like a sunshine, that's still perceiving it as light. So if we're staring at our TVs or staring at our computers, our brain is perceiving, for lack of anything better, this is sunshine. So it's not getting the hormones clicking into place. And then we go to bed, and then the hormones aren't being released on time, and our system gets messed up. The other big thing that I work on with people is their habit of eating, because if you're eating far too close to bedtime, again, you're messing up your circadian rhythm, where your liver wants to be in the mode of repairing when you go to bed, repairing and detoxification. You've now forced your liver into digestion, which is something that it likes to do basically in the lighttime hours. So these are all very, very important. This is just sort of the surface of everything. But you can see that if our clocks aren't working, then our organs and our cells are not doing what they need to be doing when they need to do it. And this can be very impactful. There's even research coming out now about taking medications at certain times of day to either prevent circadian rhythm shifts. So, for instance, I was speaking to Dr. Michael Smolensky, who's a very big doctor in the area, a researcher in the area of circadian rhythms. And they've done research where if you take blood pressure medication, say at 12 o'clock at night before you go to bed, because of the timing of how the heart works and many other things, it has a much more profound effect for preventing heart attacks than if you take it first thing in the morning. And this, again, has all to do with the circadian rhythm and where mechanisms are functioning. So a very interesting area of study. It's hard to work in the medication aspect with chemotherapies just because of execution of them. But it is an area that is being very closely looked at in cancer care.
I love this. Making this point about liver's function during day as digestion and during night as detox and repair. I've never really. That is really important. That's a real aha statement. Which we shouldn't just. I don't want that just to go past and not have our listener really understand. That's actually really quite important. It's also interesting how we've, you talk about blue light and the importance of that in terms of melatonin release, but we've come to demonize the sun as well, haven't we? And that's had a sort of another, down the other end of the scale, had an effect on melatonin production.
But when we're talking about circadian rhythm, it's really, and melatonin isn't just the sleep wake cycle hormone either. It's a very potent antioxidant. So if you look back in time in caveman days, basically we should be going to sleep as soon as the sun starts to go down, and we're up early in the morning. And that's ideal. That's ideal body function. And that's ideal. As we get older too, our melatonin production decreases, and that can become a bit of an issue. But lots of studies in the area of sleep-wake disruptions and breast cancer. There have been lots of studies, and of course you can't point a straight line at this, but anecdotal studies of nurses and incidences of breast cancer and flight attendants. So it is impactful, and it is an area that has had a lot of, because of the corollary, I guess is the best way to put it. It is being studied, and I think sleep in general, in all aspects of health, is really becoming a much more talked about point.
Yes, well, it's the big one.
And whether or not you actually really want to equate it to circadian rhythm, people who may not know the word or don't know anything about chronobiology, just in the general population, people are learning and understanding the importance of sleep for weight loss, for hormonal management. And just because we don't know the exact words and connecting them like I did, the word is getting out that sleep and proper sleep is important. So developing proper sleep strategies. I'll go through a list of things to help people sleep better. And, one of the big things and the hardest thing really is to get people to shut their TVs off and their computers off at least a half hour before bed. That's a biggie. We're so tied to our phones and our TVs. It's a tough one. And, you look at the pattern of illness and chronic illness is on the rise, and this may be a portion of it.
What are some other strategies you suggest for people to improve their sleep?
Sleeping in a cold room, sleeping in a very dark room. I suggest to people, especially if they're having a difficult time sleeping, to change up their bedtime routine. The body will respond to routines, just like it responds to the sun going down and hormone release. It will also respond if every night you do the same pattern. Your body will say, oh, okay, she's getting ready for bed now. And your body will respond and go into sort of that sleep mode. I'll often have people do some deep breathing if they're having difficulty sleeping to slow the heart rate down. And if they can't get into a room that's completely dark, to wear, the eye masks. Those are the big things. So a cool room, darkness, eye mask, routine, proper breathing. Those are all important things, slowing your heart rate down, trying to cleanse the mind. That's what the breathing does. It cleanses you. You often go to bed, especially if you're bumping up into TV time. We often go to bed and we're thinking of the next day and tasks to do. Another big thing that a lot of people have had, come back to me and said have been very helpful is writing a little gratitude journal at the end of the day. It sort of closes out your day. And it can put, active thoughts to rest once you've written things down. A lot of us go to bed thinking, oh, shoot, I got to do this tomorrow and I've got to do that. Write it down, put it aside, and you can go to bed more peaceful. Small things, it seems like, but, when you do them and execute them routinely, they're very helpful.
No, I've heard sleep described as our built-in non-negotiable life support system. So why wouldn't you use it?
That's good.
Why wouldn't you use it and it's free? How expensive is getting a good night's sleep?
It's so hard to attain that golden ring sometimes.
But I think your point actually about prioritizing it is actually the big one. Until you appreciate its importance, you don't actually elevate it. And I found it really interesting dealing with a lot of doctors and hearing unless they personally, in their own lives, consider it a priority, they actually won't convey that to their patients. That's been my experience. What do you think?
Again, back to their busyness. When I went through with my doctor and he told me not to eat as much meat, I was surprised, because I didn't expect any sort of, pointed direction on nutrition at all. And again, I don't want to come down hard, on the side of that anti in the medical field, but I just think that they're overwhelmed. I mean, the lineup of people to check in for treatments and appointments, I found it, it was outstanding to me. I was shocked the first few times I went. You had to line up for these appointments, and I just think that they've got things that they've got to focus on.
Yeah.
And that's, getting back to the beginning of the show, I just, if we could get that partnership with lifestyle coaches, with, nutrition people and doing the whole package, because, I know that there are dietitians that are associated with most cancer programs and hospitals, but a lot of people that come see me are almost frustrated with that because they seem to feel that they're lacking information and they're just being told, eat whole foods, include more fruits and vegetables, which is extremely valid. But you can only, you can eat great food, but you have to be able to absorb that. And that goes far deeper than just what you're chewing on. And that's the frustration that I'm seeing with other people, that they're getting these side effects and they don't feel that their energy has changed at all. So there's a whole lot that goes into the nutrition of a cancer patient other than just what they eat.
Now, that's a good segue into something you mentioned with sleep, and that was about timing of food. And on top of that, well, let's talk about that, because the timing of food is really important on many levels. Can you talk to us about that?
It is, and this is something that I've introduced within the last year to most people that I work with. Again, everything's individualized, so it depends on the health of the cancer patients that I'm working with. But timed eating is not, in my practice, a weight loss mechanism. Timed eating is eating within a window that helps cultivate good sleep. It helps balance hormones, and for patients going through treatment, there's been a lot of very good research that's come out that decreasing calories before treatments can increase efficacy and decrease side effects. So I like to have people with the research that's out there, and it seems to be very solid, and adding on to that the nuance that in general we eat far too much. And with the understanding now that you have of chronobiology, eating within an 8-hour window is very appropriate for proper health. So this is foreign to a lot of people, and it's difficult for a lot of people because we often will eat and nitpick right up until bedtime. And again, so now just going back to that understanding that you're sort of throwing your system off when you're doing that. You don't want to go to bed digesting food. You want to go to bed ready to repair. And we're also talking about the kidneys and many other functions. But so this is a practice that I introduce with a large majority of the people that I work with, and especially going into, and it will sort of gauge the therapy and the time frame depending upon the person sitting in front of me. But this nutritional therapy, also before chemotherapy and radiation, I will implement for cancer patients to help them get through treatment. So, for example, if I've got somebody sitting in front of me who is healthy, so if I've got somebody that's cachexic and very thin, this is not something that I recommend. So again, this is not a carte blanche for everybody, but the majority of people can do this. Will cut down their calories to below 500 approximately a day before treatment, a day and a half before treatment. And what this has been shown to do is basically weaken cancer cells so that the therapy can come in and really do a good job. And it also has been shown to mitigate side effects. And clinically, we've seen this. So the research shows it, and we have seen it practically. So this is one aspect of nutritional therapy that I use. And then as a general rule of thumb, I'll start with cutting back 3 hours. So if someone is eating, throughout the day and, right up to bedtime, often if I say, aim for 3 hours before bedtime, that's our launch pad. And again, trying to get into that 8 to 10 hour window of eating. This is not a weight loss thing. This is not the impetus for what I'm using it for, although this can be a corollary of it. Because again, you're getting your circadian rhythm in balance, you're getting your hormones in balance. And once you start doing this, a lot of health problems seem to, unwind. But this 8-hour window. There are two ways I've seen people go with it. When I first started doing it, I became very tired, and it wasn't until actually my daughter said to me, "You're not eating enough." And it didn't dawn on me because, if you're busy during the day, you get up, you don't eat till 11 or 12, and then you're stopping at 7 or 8. And that's a busy part of a lot of people's day, and you can actually not eat enough. So you've got to be very mindful that you're getting enough calories in that 8 hours. But the other side of it is it's not a free-for-all within that 8 hours as well. So that's how I use the timed eating in my practice.
Yeah, so before a cancer treatment, reducing the calories a day or so before to less than 500 is the one way to go. But after their treatment, to get them into a routine of an 8-hour window of eating and allowing 3 hours gap between the last meal and bedtime. Is that?
Yeah, so I'll start off with the 3 hours, and then we work back from there. So we'll start off with that, and if they're doing well, then we start to pare it back. So it can be a very gradual process to get in that window. And again, some people can't do it if they just. So it's a back and forth. But once people, especially people that have gone through a health crisis, once people start to see the benefit and they understand. It's much easier for them to implement. So, you realize that when people are coming to see me in Canada, it's not a health covered thing in most cases. So these people are really, they're motivated to change, which is wonderful for me, because they very quickly see the benefits of it. And, it's a very key piece to what I do.
Because, the whole idea of this restricted, as you mentioned, it weakens cancer cells, but it also, fasting is an important part, actually mops up weak cells as well, of which you would hope cancer cells would.
You're right. Yes, and it really resets our immune system. And that's a big thing. And to this, once people are through their treatments and they're really on a good path to health again, we can play around with a 1-day fast maybe, and do things like that because, I do, for instance, once every, I'll say quarter. No, that'd be too much. I don't do it that often, to be honest. So 3 times a year.
Aspirational, Cathy, aspiration.
Frank. Yeah. About 3 times a year, I'll do a 3-day juice cleanse. And it really does make you, it can be challenging through it, but it really does make you feel invigorated after, I'll play around every once in a while because I like to change things up. I think it's important to change things up. I don't like everything always the same. I'll do a 1-day water fast, things like that. Just playing around with your digestion takes a lot of energy. And when you give your system a break, it allows it to do other things. So it's quite reparative.
And that's a good segue into another thing that I wanted to ask you about, which was detox, because we hear a lot about it. People are on a detox and all of this. What should we be focusing on when we embark on a detox, or what do you focus on with your patients?
Okay, so when I'm dealing with cancer, I detox is a loaded word for me. When I'm dealing with cancer patients, for me, when I am talking to them about detoxification, I'm talking about supporting their channels of detoxification. So the microbiome that we spoke about, I won't name them all, but the liver, the kidneys, your skin, your lungs, those are all important avenues of detoxification, and your body detoxifies quite well if supported properly. But when people are going through cancer treatment, when they have cancer, we have to be very mindful. There's no room for active, aggressive detoxification during this time, especially through chemotherapy. And people would need to understand that because chemotherapy and the medications are very strong, and your body, if you push too hard to get these things out of your system, it can overwhelm your system. So when I'm working with cancer patients, I'm working on so I support the liver, we support the microbiome with proper food, rest, all these same things that keep coming back, but really enhancing our system. So I have a specific liver protocol with foods and sleep and and the nutrients that are supportive of the liver, of phase 1 and phase 2 detoxification. Things like saunas are, people often say, well, can I go into a sauna and sweat it out? Well, no. Now's not the time to do that. When we're into prevention, when you're out of chemotherapy, when you're out of treatments, then we can push a little bit. But it's key to support and not overwhelm the system when you're going through treatment.
Mm-hmm. No, I like that. I like that sort of gentle approach, because people have this idea, well, if I'm going to detox, let's get it all out. And that's not a good thing. That's not a good thing.
No, and there are back and forth studies with these huge detoxes. You read one paper and it says one thing, and you read another, and I'm very much for the conservative approach in most aspects of my life, to be perfectly honest. But when you're working with cancer patients, you need to be more conservative. You don't want to be aggressive when it comes to what I'm doing.
Listen, I wonder if we might just finish up and ask, what if you had 3, 4, 5 tips for people listening to this program and concerned about cancer, having maybe had cancer. What would be some tips you would give people?
Get your team on board. I think if you've got cancer, it's very important that you get a team to work with that you are comfortable with. So the majority of people that I see are going through the medical system. So they've got their medical doctors, their surgeons, and ask questions and feel comfortable with the doctor. Just because you're assigned to a doctor, if you're not feeling the vibe, switch it up. But then get at the other pieces of your team together, your family and friend support, your integrative healthcare support. It's very important. If you're diagnosed with cancer, you have time to do that. You have time, you don't have to rush out right away. This is an important piece of your life. It's an important chapter in your life, and you've got to make sure that you're writing it out properly. The next thing when it comes to prevention, everything we've talked about, starting off with sleep, good nutrition, exercise is something that we didn't touch upon too much, but the managing your insulin sensitivity and your blood sugar is very, very important, and a key aspect of the whole idea of inflammation. And inflammation is, at the root of chronic disease. So exercise is very, very important. You don't have to go run a marathon, but get your heart going. Do some weights for sure. Work with your mind. Spiritually, mindfully, these things are very important. Carve out time during the day to decompress. Learn to say no. These are all very, very important things. When you're diagnosed with cancer, you'll find that people come to the table that you would be surprised about, and other people can't show up for you. And that's fine. That's fine. Everyone has their place. So a lot of people are shocked and say to me, I was very disappointed, but you can't be. So those are all to me, because when I went through it, these were things that I experienced. It's a shocking thing to be diagnosed with cancer, but it's becoming more and more doable. Put your mind in the right place, get your people on board, and get the protocol and your line of attack that is good for you, and you'll feel it in your gut. You'll feel it in your gut when you know you've got everybody on board that need to be there for you.
Mm-hmm. Yeah. Look, just finally, and taking a step back from your role as a nutritionist, a cancer coach, your own experience, what do you think the biggest challenge is for people on their health journey through life in our modern world?
I think it's managing stress. I think
what a great answer for this podcast.
Brain. Yeah, because you know what? You can eat the best food. You can do all the right things, but if you can't sleep well, if you can't absorb those nutrients, it all starts with the stress. Because, physiologically, you are either stressing or you're not stressing. And only when you're not stressing, when you're in that parasympathetic nervous pathway, that's when you're digesting. Because when you're in the sympathetic pathway, the body shunts away blood and you're not digesting anything. So for managing hormones, it is key. And, research has shown when you're diagnosed with cancer, the stress of it decreases your immunity, and that's a real piece of the puzzle that people haven't quite fit into their protocol yet.
What a great note to finish on. Cathy, thank you so much for joining us today and sharing your wisdom and experience with us.
Thank you for having me. I really appreciate it. I had a great time.
As though you needed reminding of how important stress is, even on the best diet, even with the best supplements, but it's an important message, and the influence also of circadian rhythms and in getting a good night's sleep is, as we know, so important. Go back and have a listen to that amazing episode I did at the beginning of the year with Jason Borden-Smith. That will blow your mind as well. Talk about circadian rhythms and mitochondrial health. We'll have links to Cathy's website and her book, Chemotherapy, Radiation, Surgery, Natural Strategies for Dealing with the Side Effects of Cancer Therapy Treatments. Now, we have some great things planned this year. There are free webinars and some ebooks on the website. There's also a 5 Pillars and ebook, 5 Pillars ebook, and a 5-week 5 Pillars online course with live Facebook Q&As every week. So look out for that. Now, don't forget to download the Unstress app at the App Store or Google Play and keep up to date with all the episodes, the blogs, the courses and the events. And of course, leave that review on iTunes and help us get that message out there. If you go to the show notes, there'll be a link to make it even easier. So until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner.